Breaking the cycle, the intersections of poverty and sexual and domestic violence. In the United States, roughly 1 in 3 women and 1 in 6 men will experience sexual or domestic violence in their lifetime, according to reports by the Centers for Disease Control and Prevention. An estimated 10 million assaults occur across the country annually, making it an extremely prevalent problem. The number of reported cases of sexual and domestic assault is only 31% and 52% respectively, indicating that there are significantly more cases than are reported. The scope of this paper is limited to the U.S., as attempting to articulate the causes and consequences of domestic and sexual violence on a global scale is much more complicated, and rampant underreporting makes statistics from some regions unreliable. While anyone can experience assault, the probability of experiencing sexual or domestic violence within the United States is significantly increased for minority groups and those living in marginalized communities, especially those living in poverty. The resource disparities and increased levels of stress, two consequences of poverty, often create high levels of household tension, thus leading to disputes between intimate partners and subsequently heightened levels of domestic and sexual violence. Furthermore, 38% of domestic violence victims will become homeless at some point in their lives, according to a fact sheet produced by the American Bar Association's Commission on Domestic and Sexual Violence. While many people believe that sexual and domestic violence is an isolated issue, the causes and consequences of such assaults on individuals and how they impact the health and well being of the victims demonstrate the intersectionality between poverty and sexual and domestic violence. Therefore, in order to develop a comprehensive understanding of poverty, it is imperative to study the effects of domestic and sexual violence on individuals, how poverty increases the likelihood of experiencing such assault, and how experiencing such assault increases the risk of continued or worsened poverty. Instances of domestic and sexual violence are seldom out of the blue cases. In many situations, identifiable commonalities among cases emphasize shared characteristics. Researchers and police have identified several trends in perpetrator characteristics, such as mental health struggles, stress, witnessing abuse of the child, and the environments in which they live. Environmental factors play a large role in abuse. In localities with high crime and poverty rates, domestic and sexual violence are more likely to occur. This is likely due to increased financial strain and the stress associated with living in an impoverished area. While individual psychological behaviors influence the perpetrator's decision to incite violence, the structural conditions the perpetrator was exposed to as a child or currently lives in carry a more significant influence. Connections between poverty and sexual and domestic violence often run deep and can perpetuate the formation of abuse cycles if not addressed. Childhood experiences can impact both the cognitive and physical development of youth and be determinants of future outcomes. In a report produced by the U.S. Department of Justice, citing a research paper written by Kansas State University professors, it was found that the victims of physical abuse are 1.7 times more likely than others to commit violent offenses later in life. However, it is important to note that in the same paper, there was no significant correlation found between individuals being victims of sexual assault and later becoming sexual abusers. While the correlation of victims becoming abusers is sometimes contested, it is a long studied and proven fact that childhood experiences directly impact future behavioral patterns. In impoverished communities, likelihood of experiencing abuse, whether firsthand or as a bystander, is significantly increased. In a report produced by the Office of Legislative Research for the Connecticut General Assembly, children living in households making $15,000 a year, as compared to those living in households making $30,000 a year, were 15 times more likely to be victims of physical abuse and 17 times more likely to be sexually abused. Combined, these reports underscore the importance of understanding the relationships between poverty and sexual and domestic violence from the roots, childhood. Children living in poverty are more likely to experience or witness abuse and subsequently more likely to become perpetrators of such violence. Furthermore, the financial and resource strains on impoverished households, combined with the increased stress levels associated with poverty, increase the probability of domestic and sexual abuse. In an article published by Connections for Abused Women and Their Children, socioeconomic status correlates directly with domestic and sexual violence. In fact, some studies indicate that financial strain may be the most detrimental factor for domestic abuse. Financial strain within a household can lead to disputes over housing, money, and basic necessities, often resulting in violent disagreements. In an article published by Mass General Brigham, a hospital in Massachusetts, a study found that 15% of all assault related injury visits occurred during holiday periods, a noticeable increase in the annual visit trends. These results suggest that during seasons of heightened stress related to increased expenditures, already resource strained households experience further economic uncertainty, leading to violent outbursts in response to the stress. Critics might argue that therapy or other medical treatments and medications might be simple solutions to reducing stress. However, many impoverished households have no insurance or only limited coverage, making such solutions inaccessible. Poverty also contributes to a victim's ability, or at least their perception of their ability, to leave an abusive situation. In a staggering 99% of domestic violence cases, financial abuse is used as a means of entrapping a victim, according to reports published by the National Network to End Domestic Violence. Whether it be coercing the victim to relinquish control of their bank accounts and assets to the perpetrator, forbidding the victim from working, or committing fraud under the victim's names, there are countless ways in which victims can become seemingly stuck in both a situation and in poverty. In a national survey conducted by the California Partnership to End Domestic Violence, 73% of survivors indicate that their financial situation affected their ability to leave their situation very much or extremely. Poverty is often described as being sticky and an incredibly difficult situation to escape from. This same stickiness applies to sexual and domestic violence victims, as financial constraints, among other factors, make it hard for victims to escape the situations and generate enough upward mobility to prevent them from falling back into poverty or abuse situations. Among domestic violence who do leave their situations, 38% will end up homeless at some point in their lives, according to research presented by the American Bar Association's Commission on Domestic and Sexual Violence. Many survivors face difficulty in obtaining and maintaining safe housing due to their previous economic dependence on their abusers. Many survivors are also unemployed or have a poor history in maintaining a job. Subsequently, they often have poor credit or poor rental history as a consequence of their situation. Survivors of domestic and sexual violence frequently hold little control over the financial actions of their abusers. However, the long term effects of those actions extend beyond their initial escape and can be crippling. These factors make it increasingly hard for survivors to restart their lives and escape from poverty during an already difficult period in their lives. Furthermore, marginalized communities like ethnic and racial minority groups, immigrants, and the LGBTQIA community often experience amplified difficulty in overcoming these obstacles. This sad reality often places them among the victims at higher risk of experiencing poverty, homelessness, or repeated abuse, as societal stigmas and stereotypes often exacerbate these challenges. In a fact sheet published by the Office of Family Violence Prevention and Services, roughly 93% of homeless women experience severe physical or sexual abuse in their lives. This alarming statistic emphasizes the strong relationship between poverty and domestic and sexual violence. There are numerous resources in the United States aimed at aiding survivors of domestic and sexual violence. There are approximately 2,796 domestic violence shelters in the United States and thousands of homeless shelters. Additionally, there are multiple federal and state level programs aimed at assisting victims of sexual assault and providing funding to nonprofit organizations that help survivors. One such example is the Violence Against Women Act. These government funded programs provide vital support to nonprofit shelters and organizations, but they are often underfunded and can create stigmas around who can and cannot receive assistance. For example, VAWA only includes the word women in its title. To many, this may seem like an insignificant technicality. However, to non women identifying victims, it can make the problem seem inaccessible and undermine their experiences or how they think others might perceive them. While some people might look at these resources and deduce that there are adequate support for survivors of domestic and sexual violence, and that the likelihood of survivors slipping into poverty is low, that is not the case. In a study produced by the Office of Family Violence Prevention and Services, in just one day in 2015, over 31,500 adults and children fleeing domestic violence found refuge at a domestic violence shelter or transitional housing program. However, during that same day, 12,197 requests for services, 63% of those being for shelter, went unfulfilled due to a lack of funding, services and resources, and staffing. Furthermore, emergency shelter and traditional housing continues to be the most unmet need for survivors of domestic and sexual violence. In a study conducted in Florida, the experience of violence and assault was the primary reason for 1/4 of the studied women's homelessness. Without sufficient resources to support survivors, many who choose to leave end up in poverty. Conversely, many who choose not to leave stay out of fear of further financial hardships and insecurity. Regardless of their choice on whether to leave or stay, victims of sexual and domestic violence have a risk of ending up impoverished, and people living in poverty are more likely to become victims of sexual and domestic violence, thus creating a dangerous cycle. Victims should not feel forced to stay in their situations, but they also should not have to face financial uncertainty immediately after deciding to leave. All survivors of sexual and domestic abuse should have access to shelters and other assistance programs aimed at helping them navigate the recovery process and helping them adjust to a new life of independence. Therefore, the United States has a moral imperative to provide sufficient shelter services and programs to help all victims who seek assistance. One of the most morally permissible and politically feasible ways to reduce poverty caused by domestic and sexual violence is to help victims economically. One way to do this is to assist survivors in finding sustainable jobs and to promote financial independence and literacy. However, for this method to work, there must be accessible programs in place in areas of facilitation where victims can first recover and then be supported in gaining further independence. As it exists today, there are insufficient facilities and programs to help victims, thus preventing many from successfully obtaining upward mobility and escaping the causal relation of sexual and domestic violence and poverty. This must be a priority for governing bodies, as it is a key not only for helping survivors, but also to opening up further opportunities for sustainable support. Skeptics of this causal link between poverty and sexual and domestic violence argue that such violence occurs regardless of socioeconomic status. Therefore, focusing on cases and statistics for people living in poverty disregards cases of high income abuse. There are many reported cases of sexual and domestic assault in affluent communities, and it is important to provide the same level of care and dignity to all victims, regardless of socioeconomic background. However, the highest rates of sexual and domestic violence occur in already disadvantaged minority groups, with the highest rates of reported violence occurring in Native American, Hispanic, and Black communities, as demonstrated in a report published by the National Institute of Health. Furthermore, in a study analyzing the connection between intimate partner violence and neighborhood income, conducted by multiple professors and medical experts, police reported sexual and domestic violence rates were the highest in lowest income neighborhoods, and the next highest reporting level was the second lowest income level. This study suggests that poverty is directly linked to domestic and sexual violence. In addition to reported abuse rates being the highest among low income, marginalized communities, the long term financial burdens that survivors often face strengthen the connection between poverty and domestic and sexual violence. In a research article posted by the Centers for Disease Control and Prevention, the estimated per victim lifetime cost of rape in the United States is $122,461, and the estimated total population economic burden of rape is roughly 3.1 trillion over victims' lifetimes. These costs include medical expenses, lost productivity in the job market, and property loss and damage. It is important to note that not all instances of sexual or domestic violence are instances of rape. However, the costs for victims of rape, as outlined by the estimated number above, are not an insignificant amount, especially when considering that many victims are already living in poverty. Not only do victims have to escape the situations and overcome the initial recovery stages, but they are also then left with significant long term financial responsibility for something that was not their fault in the first place. In contrast, high income abuse victims have greater access to an array of treatment options and can sustain themselves in periods of recovery, making it more effective. Low income individuals have limited treatment options, must oftentimes foot the bill for expensive uninsured medical costs, and cannot afford to take time off work to properly recover, which leads to many victims not being properly treated, leading to long term depression or trauma reactions. This is not to say that high income abuse victims should be responsible for their own recovery and treatment costs. However, the argument is that they have the ability to do so, while low income victims do not possess the same ability. These added financial burdens on survivors can contribute to the causal and consequential relationships between sexual and domestic violence and poverty. In order to understand and address sexual and domestic violence, one must have an understanding of how poverty and socioeconomic contributors relate to such violence. Additionally, in order to tackle one of the contributors of poverty, one must comprehend how cases of sexual and domestic violence can cause cases of poverty. The two concepts go hand in hand. To understand and address one, it is imperative to grasp the other. People have a moral obligation to study and stop sexual and domestic violence, as it is a violation of human rights and personal dignity. Given the causal connection between sexual and domestic violence and poverty, it is crucial to study and effectively address such cases of violence, as addressing the cases would likely lead to a reduction in cases of poverty. Poverty is often described as sticky, and sexual and domestic violence is often described as a cycle of abuse. But by understanding and addressing the intersectionalities between the two of them, there is hope of helping individuals achieve upward mobility and breaking the cycle.